Okay, let's dive right into this. Welcome to today's Explainer, where we are going to unpack a truly incredible, honestly mind boggling dichotomy right at the heart of the American healthcare system. It's a system that is literally capable of absolute medical miracles, and yet it can become entirely paralyzed by the simplest, most basic tasks imaginable. Today, we're looking at a firsthand account that perfectly captures what happens when flawless medicine collides with a completely broken bureaucracy. We'll also explore why mixing in stories exactly like this one might actually be the key to really understanding our healthcare crisis. So, think about modern medicine for a second. We can replace a human heart, right? We can reattach severed limbs. We can map your entire genetic code while you're just sitting there reading a magazine in the waiting room. But what happens if you need the system to perform a total entry-level task? Something with the mechanical complexity of, say, untying a shoelace. Well, as our source material reveals, the whole multi-billion-dollar machine just grinds to a halt. Putting stitches in is treated as high-level, life-saving medicine, but taking them out, apparently, that is an unsolved engineering problem. All right, so our story begins in the winter of 2019 with a classic, face first, gravity always wins, fall on the ice. The author's face was busted up pretty badly, blood everywhere. Being a totally reasonable person trying not to clog up the emergency room, he went to an urgent care first. But the receptionist took one look at him and correctly directed him to the ER. And here is the absolutely crucial point to remember. At this stage, the system worked perfectly. The ER doctor was an absolute pro, stitched his face back together like fine upholstery, and handed over the discharge papers with one very simple instruction. Get these stitches out in exactly 2 weeks. Sounds easy enough, right? Well, there was a hard deadline rapidly approaching. We're talking about a 3-week countdown clock ticking in the background that turned this super simple follow-up appointment into a literal race against time. The patient had a massive, unmissable event exactly 3 weeks after the accident. That meant the doctor's 2-week timeline for stitch removal wasn't just a casual suggestion, it was an absolute non-negotiable necessity. And those stakes were incredibly high because exactly 3 weeks after the fall, a massive presidential campaign rally was being held at Navy Pier in Chicago. The author wasn't just hiding in the back of the crowd either. As a state central committee person, he had a seat in the VIP section, right up against the security fence. We were talking local political power brokers to his left and right, television cameras panning the crowd, and a guaranteed face-to-face handshake with a major presidential candidate. As he hilariously puts it, he couldn't exactly stand there looking like he lost a knife fight with a sewing machine. Those black threads absolutely had to go. So, the 2-week mark finally hits. Time for the removal. He calls his primary care physician, the person whose literal job title is to primarily care for him. He just asks for a quick stitch removal. The receptionist clicks a few keys and cheerfully offers an appointment in 3 weeks. He pushes back, logically pointing out that by that time, the stitches will have been in for over a month. They wouldn't even be stitches anymore. They'd be biologically tethered to a piece of nylon. They'd basically be part of his DNA. But because his doctor's in a different city at a different hospital, within the same massive health system where the computers apparently refuse to talk to each other, an on-time appointment would require an actual time machine. Hitting that first bureaucratic wall, he pivots to what should be the easy, foolproof backup plan: urgent care. He walks in, explains the situation, and gets hit with this just baffling response. Oh no, we can't do that. We only remove stitches that we put in ourselves. I mean, it's an absolutely stunning rejection. Just think about the pure absurdity of that for a second. What is this, a fast food franchise model? Are they protecting intellectual property? The author actually starts wondering if stitches come with a corporate warranty. Like, sorry sir, those are Northwestern Medicine stitches, we only service Mercy Health. It's hilarious to think about. Did the stitches become emotionally attached to the original doctor? Do they have abandonment issues? But of course, it's not a medical restriction at all. It's corporate policy. It's our liability culture running completely amok. You apparently have to return to an authorized stitch dealer. Desperate, he goes to a second urgent care. And here is where it gets truly wild. This second clinic is actually in the exact same health system as the hospital that originally put the stitches in. He walks in, explains the deadline, and literally offers them cold, hard cash. He's like, take American currency, just pull the strings out. They still refuse. And their official medical advice? They tell him to go back to the emergency room. Think about the bureaucratic nightmare he was trapped in here. 2 weeks earlier, urgent care told him to go to the ER. Now urgent care is telling him to go to the ER again. It basically turns the emergency room into the Hotel California of healthcare. You can check out anytime you like, but you can never, ever leave. The staggering, mind-numbing absurdity of what this system was demanding becomes crystal clear when you look at the facts. On one hand, You have the actual purpose of an ER. Heart attacks, strokes, car crashes, people fighting for their very lives. And on the other hand, decorative string in a man's face? It is exactly like calling the fire department because you need someone to change a light bulb. But, buried within this story is a huge, often overlooked issue. Hospitals are constantly complaining about low Medicare reimbursement rates and intense financial struggles. Yet, by insisting this patient return to the ER, which is the absolute most expensive healthcare delivery method with terrible reimbursement margins, just to snip a thread, the hospital system is actively creating its own sustainability crisis. They are quite literally bankrupting themselves with their own bureaucracy. So it's the day before the massive political rally. Every single institutional door has been slammed shut in his face. He is trapped in a maze of liability and red tape. The system has entirely failed. So what do? Well, you turn to a secret weapon. In this case, his wife. Now, she wasn't just taking a wild guess here. She happens to be a former veterinary assistant with extensive experience in sterile techniques, wound care, and surgical procedures. She has literally removed stitches from dogs, cats, horses, and, wonderfully noted in the source, one goat with a serious attitude problem. She is vastly overqualified to pull nylon out of a human face. But initially, she refuses. Not because she can't do it, but on the absolute rock-solid principle that they pay a fortune for health insurance, and she shouldn't have to treat her husband like a golden retriever in the kitchen. But hey, desperate times call for intense domestic diplomacy. Treaties were signed, negotiations were made, and a fee was finally agreed upon. The cost? One high-end spa day, a facial, cucumber slices, and a Swedish massage. And with that secured, she grabbed the tools and in exactly 5 minutes, snip, snip, pull. The stitches were out. No infection, perfect healing, barely a scar to this day. Let's look at the final scoreboard here because it really sums up this whole explainer. The hospital system couldn't remove them, the primary care doctor couldn't remove them in time, 2 different urgent cares absolutely wouldn't remove them, but his wife did it in 5 minutes flat. Healthcare might be the only industry on earth where highly trained professionals keep referring you out to other highly trained professionals until, eventually, your spouse just fixes it at the kitchen table. Every referral sounds so sophisticated, but the actual solution was the least institutional one possible. After this whole ordeal, the author jokes about taking the receipt for his wife's spa day, tossing it in an envelope, and mailing it to his health insurance provider labeled medical expense, suture removal. And honestly, he has a solid point. If the spa day was literally the only effective treatment available to him within the medically necessary time frame, doesn't that technically make the Swedish massage medically indicated? Of course, we all know the insurance company would immediately send a denial letter stating a deep tissue massage isn't medically indicated. Yet ironically, it was vastly more effective than anything the actual medical system offered him. The medicine itself wasn't broken. The bureaucracy was. But this brings us to a really fascinating insight into how we actually talk about healthcare reform. Organizations pushing for systemic change often share these catastrophic, life-ruining medical debt stories. And while those evoke deep empathy, human nature is funny. It often triggers psychological denial. People hear it and think, yes, that's terrible, but it's extreme, that will never happen to me. After a while, those stories kind of lose their impact. But a story like this, being bounced around town and paying your wife in spa days to cut nylon out of your face, that is highly relatable comedy. It completely bypasses our denial and proves that the system's rot affects everyone, every single day, even in the smallest ways. Which leaves us with a pretty provocative realization. The system worked exactly as designed, and that is the problem. The next time you find yourself bouncing between phone menus and referrals for something that should literally take 5 minutes, just remember the decorative string and the golden retriever in the kitchen. Are we designing healthcare systems for patients, or are we designing them to protect the system itself? Thank you so much for joining me for this explainer. I hope it gave you some clarity and maybe a little bit of sanity the next time you have to navigate the medical maze.